So, before learning how to localize an MI on an ECG, it's important to learn the blood supply of the heart. So, the blood supply of the heart is done by a coronary artery, the left coronary artery and the right coronary artery. The left one is also known as the LMC, that is the left main coronary artery, which divides into the left anterior descending artery and the left circumflex artery. The left anterior descending artery supplies the upper two-thirds of the intraventricular septum, the anterior wall and varying part of the lateral wall. The left circumflex artery supplies the lateral wall through marginal branches and varying part of the posterior and inferior wall. Now coming to the right coronary artery, it supplies the lower one-third of the interventricular septum, the right ventricle and varying parts of the posterior and the inferior walls. Now coming to the localization of an MI. So if you see ST elevation in V1 to V4, that is anterior wall MI, culprit artery will be left anterior descending artery. If you see ST elevation in leads 1 and AVL, that is lateral wall MI, culprit artery will be left circumflex or branch of left anterior descending artery or left coronary artery. If you see ST elevation in leads 2, 3 and AVF, that is it is an inferior wall MI. Now if the elevation in lead 3 is more than lead 2, that is the culprit artery will be right coronary artery. But if the ST elevation in lead 2 is more than lead 3, then the culprit artery is left circumflex artery. Follow for more such content and become an ECG expert yourself.